Jackson CEO Carlos Migoya announced this week that he tested positive himself for the virus. I started our interview by asking him, how's he feeling?
I feel great. I have no symptoms, and frankly, the only thing I'm doing is I'm working many long hours, basically staying my entire time on the phone.
So let's talk about how prepared the hospital is. Are you comfortable right now? Do you have the supplies, the PPE, the ventilators, all those things you need? Or, are you looking at, will you be questioning whether or not you have enough 3-4 weeks from now? Give me an idea of what you have currently and what you feel you may need down the line.
Well, so obviously, as you know, we're flying blind to a big degree on this because we really don't understand the magnitude. We know that the bug lives in the people for 27 to 34 days. So there's a process that goes through that. We know that the lockout started approximately 2 weeks ago. So we're going to start getting to the point in which we'll start seeing the reaction and less contamination as the lockout has actually worked. Is it 100% right? No, but it's about 95, 97%. People are staying home. So from that perspective, it's working better. But we still don't know if there's going to be a big surge and how steep is that surge going to be. That's part of the challenges we have today. I will tell you that we've gotten enough supplies, we've got enough pharmaceuticals, and we started looking at this in December. Our pharmaceutical team was translating from Chinese as to the medicines that were working in Wuhan back in December, that we can pre-order some of these things, the hydroxychloroquine and some of the other medicine. So we have enough. Now, if we get a huge surge, which I don't believe, I think there's a very, very slim chance of getting it. I don't think anybody is prepared for that, just like New York is. I really believe, and if you believe the numbers that you're going out there, and we believe in the Washington model, and everybody's talking about that we will peak out towards the end of April, I think we have enough supplies to do that. The only challenge that we have is on ventilators. And the state knows we want to make sure, not just at Jackson, because we're working in a coalition. I want to assure you and the public out there, every hospital in Dade County is working together. Baptist, Jackson, University of Miami Hospital, Nicholas, Mount Sinai, the HCA team, the attendant team, we're all working together, understanding exactly the number of patients we have every day, how that number is growing, and what our needs are. And we want to make sure that we have enough vents so that in case any one of our hospitals need them, we can move them around, and we need to have them on site. And for that number, we want to get 300 to 500 here on site. I know that the emergency director, Jared Moskowitz, who, by the way, is a Broward kid and doing a great job, is trying to identify those numbers right now and trying to help us in every way he can.
How unusual is it, the system that you described of all the hospitals working together, typically you compete with one another for a business model. I mean, you're competing with Baptist, you're competing with HCA, you're trying to get people to come into your hospital to do elective surgeries here because that's how you stay afloat and run the other parts of your hospital. How strange is it to be actually cooperating with those other hospitals?
Extremely. This is bigger than any one of us. This is a community thing. We need to make sure nobody's making any money off of this thing. Everybody's losing a lot of money off of this thing. So we really are doing this for the better of the community and make sure we can all get past it. And that's why we need to cooperate and work together. And by the way, we're not just doing Miami-Dade. The two Broward hospitals, Broward Health and Memorial, who we've had a great relationship with because of the two public hospitals, they're part of this as well. So when it comes to Dade and Broward County, and to your point, it's a rare. Everybody's working together to coordinate exactly what we have.
All right, so here's the issue that I think is a real concern, and I think it's a legitimate concern. You are not able, as I understand it, to do the types of testing, the level of testing of your own staff and of patients coming in that you would want to do. Is that a fair statement?
Well, we are doing the testing, but it's taking us a while to get the results of those testing. It's taking between 2 and 3 to 4 days to get some of those results. Internally, we're doing 200 tests a day, which is not enough for everything we need to do. One of the challenges that there is out there, and there's going to come a time in which we'll need to figure this out, is when do we get all the results where we do all the testing strictly for the inpatients. One of the challenges that every hospital has, when you got a patient walking into an emergency room, we don't know if that patient is positive or not. And sometimes it's taking 2 or 3 days to understand that. We need to understand that information right away. So in Dade County today, for example, we're doing 1,500 tests a day through drive-thrus. The question is, how valuable are those drive-thrus versus if we did not have those tests, and we use less tests and do it more for inpatients, does that give us a better opportunity of getting to that patient quicker and having a better outcome with that patient? Because the issue here is not whether you have it or not. The issue is knowing that you have it when you're sick, because once you get into the hospital, Jim, and this is critical, that disease works very rapid, and you can go from moderate to acute very quickly. And we need to make sure that we understand exactly where that patient is so we can provide the right vents, if they need to be trached, whatever else is necessary. And for that reason, we need information. We cannot afford to wait 2 or 3 days on that inpatient.
But it's not just the patients that need the testing. From what I understand, you also need to be probably doing more testing of your own staff. If a member of your staff comes into contact or learns that they've come into contact with someone who was COVID positive, you may have to take them out of work while they quarantine or do a test. If you were able to quickly do tests and more widely test it among your staff, wouldn't you be in a better position? And when will you get to the point where you will be able to test staff on a much more widespread basis?
So we've already tested over 900 of our employees. And of that 900, only 60 have tested positive. And obviously, and we have protocol as to exactly what that is, and anyone that have symptoms, what they need to be doing and how they need to work. But anybody that tests positive, it has to obviously be isolated, have to be home in quarantine. And we're working through all the CDC protocols. You're absolutely right. We need to make sure that we test not just once, but test every 2 or 3 days, every one of those employees, because we want to make sure that they're covered. We're also, by the way, separately from that, identifying places that they can stay, because a lot of times, healthcare workers are no different than you or me. When they go home, they worry about if they're positive, are they passing it on to their family? So some of them are not even wanting to go back to their home. So we're identifying places for them to stay so they don't have to be able to worry about the contamination with their families.
We'll be right back after the break.